the Infinity Workforce Solutions Fast Forward webinar series. My name's Steve Kessler. I'll be the host for the program today. And boy, do we have an important topic today. The FMCSA Drug Clearinghouse. We're going to talk about that and a lot of the details about the Return to Duty program. This seems to be a topic that has raised a lot of activity, a lot of questions, a lot of misunderstanding. So hopefully we're going to get a chance to clear some of that out today. Welcome. Appreciate y'all coming. Why don't you jump on the chat real quick and just put in who you are and what company you're with, maybe where you're located, so we can kind of know who's out there. And while y'all are doing that, I'm going to introduce my co-host. Those of you that have been on our programs before will know Mark Ray. Mark's been working with us for quite a while now. He's a veteran trucking company executive, I think 35 plus years, I believe, Mark. He's a certified CDL and commercial vehicle inspector, I believe, or trainer. Spent a lot of time in risk and dealing with a lot of the same things you all deal with every day. So what do you think about the program today, Mark?
I think it's extremely important today. You were saying how long I've been in this business. I can clearly remember when they started doing drug screens back in the 80s or so. And it's come a long way, but we now have the clearinghouse. I'm sure some of you had a little rough start with the clearinghouse. I'm going to think it's normalizing. I'm sure Grady will address some of the ongoing issues there at the clearinghouse. But this return to duty status, I got some numbers that like 31% increase in marijuana violations in 2022. The numbers are staggering, and we've got to figure out how to make all this work. So I'm really looking forward to Grady's presentation. I know we've got a lot of questions. We'll try to get all the questions answered that we can, but we got to get through this most important presentation this afternoon. Thank y'all.
Great. Thanks, Mark. Thank y'all for typing in the chat. I see a bunch of you have joined, and that's great to see. I see some current customers out there too, so y'all welcome. Let me introduce our guest today. Today we have Grady Phillips. Grady currently is the Chief Revenue Officer for Workforce QA. Isn't that right, Grady?
Yes, thanks for having me. Guys.
Yeah, Grady's a 20-year veteran in the drug and alcohol industry, so I don't think I could have found anybody that knows more about this probably than Grady does. So he's really become an industry leader. He speaks on drug testing, DOT physicals, sleep apnea. So he's really kind of tuned into all this. Grady, thank you so much for coming. And if you're all set, I'm going to turn the program over to you.
Absolutely. And again, thanks to both of you. Thanks to everybody on today. We do hope that you learned something. I'm sure there will be tons of questions, and we'll do our very best to get to them as we go through. Hopefully we'll be able to address some of those up front. So first slide, just covering the same information, Steve, Mark, myself, on the team today, and we'll jump right in. So today, the Return to Duty program details. A little bit about Workforce QA. We always want you to know who's talking to you. We've been in business for over 20 years. As Mark said, the drug and alcohol business has been around for a while now. We are a full MRO TPA, so that's a medical review officer and a third-party administrator nationwide, all types of testing, and we do about 800,000 tests every year. We've been doing that for a long time, so we are one of the industry leaders in this area. We have the industry best post-accident service. We offer secondary review for DOT physicals, and that's something that's very, very timely with the changes, as Steve mentioned earlier, the DOT physicals, that the guidance for those has made a complete change in the last few weeks. We also now offer background services. We're a credit reporting agency and perform all background services that go along with DOT and non-DOT alike. But today, we're talking about the clearinghouse. So how did we get here, right? That's a question. Mark brought up the history. A lot of us have been around this industry for a long time. What's the clearinghouse? What's going on? Well, the drug and alcohol testing in the DOT started in '91. The regulations were passed in the late 80s, like Mark said, but we really started with the DOT drug and alcohol in 91. Every year we have had positive drugs ever since then, for many, many years, positive drugs, and we've removed drivers, done a very good job when a driver has a positive test being removed from that company. The problem was that we had a gap in tracking those violations across companies. If somebody left a company due to a positive drug test or refusal, all they had to do was conveniently forget to list that on their experience, and it was a challenge to find that person had had a negative drug and alcohol experience or positive test as they moved on. Now, the clearinghouse was actually conceived many, many years ago, but a long time ago we were a lot more worried about Big Brother than we are today. And the idea of the government having a list of our clients or our customers or our drug tests, our drivers, was a big problem. And so it kind of got shelved for many years. But it's been, was worked on all through the 2015s. It took a long time, and it actually started January 6, 2020. What finally came out, and these are some of the misconceptions about the clearinghouse that I hope that we address in a little while, is the privacy concerns, how they got around that, and how they actually made this into a good program. It's important to know, though, the clearinghouse did not change any violations. The clearinghouse is just tracking those violations. And so the violations that we see on the clearinghouse are just representative of what's always been out there. That said, since the clearinghouse has started, we've hit over 250,000 violations that it has tracked. It really shone a spotlight on what's going on with the drug and alcohol. So how many violations? 250,000? As of December 31st, according to the clearinghouse report, it's actually 251,438 for those of you who like specifics. Now, it's clear that most of these violations are, in fact, drug positive. So if you look at the chart to the right, the light blue color, these are drug positives, and you can see it broken down by year. Started in 2020, kind of got its feet underneath it. 2021 ramped up. 22 and 23 have been fairly consistent with about 68,000 violations per year. Remember, these have always been here. It's just now we get to see them. The darker blue and then the really dark blue, respectively, are the violations, the refusals, and then actual knowledge, which we would like to cover a little bit as we go on the details of actual knowledge, where an employer actually posts a violation based on, literally actual knowledge of drug use. The job of the employer is to check for these violations with queries or searches. That's the whole point of the clearinghouse. So what kind of violations are we looking for? And hopefully I'm covering a lot of ground here that people already know, so I'll kind of hurry through it, but then when we have questions, anybody has a question, a lot of this we can refer back to. So what are violations that go into the clearinghouse, right? So an employer or their TPA, but the TPA can help, but at the end of the day, the employer is responsible for posting violations due to an alcohol confirmation test of over 0.04 or a refusal. So alcohol positives and refusals must be reported by the employer. If a person refuses to take a drug test, and refusals can be complicated, right? A refusal to take a random or post-accident or reasonable suspicion test, those are easy. Refusals to take a pre-employment, we'll cover that in a little while. And then lastly, actual knowledge, which we've already talked about and we'll get into more detail. These are all requirements for the employer, not the MRO. The MRO's job is to report positives, adulterated or substituted drug tests, and then also some refusals. So specifically, if somebody goes in for a test, they're there for the full 3 hours, it might possibly be because they have a biological condition known as a shy bladder, or they could be a refusal. And that's where the MRO steps in to help determine which of those two it is. So what are the common issues that we find with violations? Reporting a pre-employment refusal. That's what we just mentioned. A pre-employment test starts when the applicant touches the specimen cup. If you tell somebody to go take a pre-employment test and they don't do it, that's not a refusal. If somebody drives all the way to your office and then they decide to leave, that's not a refusal. If they go to a medical clinic, a collection site, and they look in the window, they walk in the door, they even sign their name on the register, it's not a refusal. Until that process starts, it's not a refusal. However, when it starts, when they've touched that cup, it's treated just like any other drug test. You can't leave because your grandmother called. You can't leave because your kids need to be picked up for school. You can't leave because you feel sick. That test is on. It's a DOT test, and it must go to completion. If a driver stays the full 3 hours and they can't provide that specimen, they'd go through those shy bladder regulations like we just talked about. Those if you read the regulations, you have to work with your MRO to determine if it is a refusal or not. We're not going to go into the details of a shy bladder here, but it's important to know this is a situation. The 3 hours is key. If the donor applicant stays 3 hours, you have to go down the shy bladder. If they leave prior to that, it should be a refusal, and you should never give someone permission to leave as an employer or any of your managers. If they leave prior to those 3 hours, it should be considered a refusal. There are no do-overs. There are no situations where, oh, I just can't pee today, let me come back tomorrow. It doesn't work that way. A DOT test is you start and you finish it. The actual knowledge is very specific, and it's different from reasonable suspicion. It's different from training or testing, right? Actual knowledge, and I think that's what's on my next slide. Yep. Actual knowledge, so this is directly out of the regulations. It means actual knowledge that is based on the employer's direct observation of the employee. So you see someone using alcohol while on duty, or you see someone using illegal drugs, cocaine, marijuana, some other drug that they don't have a prescription for, illicit drug use. Another one is you can be informed, information provided by the driver's previous employer. We don't see that one very often. By far and large, the question is, my driver just got a ticket. Is that a actual knowledge? Well, here's the key. For a traffic citation, they must be driving a commercial motor vehicle, and they must be, it has to be a moving violation. So if you look down to the bottom, they have to be charged driving a commercial motor vehicle while under the influence of alcohol or controlled substances. Possession is not actual knowledge. And I know that's tricky, but this is, it's a DOT regulation. So if somebody gets a ticket for possession of paraphernalia or even substances, that's not actual knowledge. It has to be a moving violation while under the influence. As an employer, reporting actual knowledge is very important, right? As an MRO, one of the things that we do that makes our job important to the world is the belief that we are keeping the roadways and the air and the rail a little safer. We want to get these people off the road that are using drugs illegally, along with all the things that go along with it. Employers, and I know that we have a lot of employers out there, your job is the same. And this is how you have to help enforce that, with the actual knowledge and doing it correctly. You don't want to put anybody a violation in where it's not justified. But on these actual knowledges, as you saw from that chart earlier, there's not that many that are put in. There's a lot more opportunity when you see somebody to do something. I'll get off my soapbox now about actual knowledge, but you can tell that's a passion of mine. So what happens after a violation, right? So some of these things happen: a positive drug test, a refusal, a actual knowledge. The driver must be removed from safety-sensitive duties, and the employer, that's a lot of you guys out there, have to give a listing of SAPs. And I think the regulations actually say listing of SAPs in their area. These days, that's gotten a lot wider because SAPs can practice in a much bigger area. And the substance abuse professional does not have to meet face-to-face. That's a COVID era change. They can now meet virtually or whatever works for the SAP, so they can operate in a lot bigger area than they used to. The employer is not required to terminate the driver, although most do. Very few do we see that actually maintain the driver through the SAP process. Most get terminated, give a listing of SAPs, and wash their hands. This part is important. We see this a lot. The employer is not required to provide SAP treatment services. We've heard that a lot of times where the driver thinks that they have to pay. Employers call and say, we've had this violation and now we're this SAP is wanting us to pay for it. That's not at all true. The top three are what you must do. You don't have to provide SAP treatment or services or cost. All right, let's look just a minute at the clearinghouse report. So this one is the most recent one as of January 1st, unless they've come out within the last couple of days. And this is where we get a lot of our numbers. The clearinghouse report is free. It's available on the clearinghouse if anybody wants to take a look. They run a month or two behind a lot of times, but this one goes through January 1st. And if a lot of you may notice, look at that 226,000 and you say, well, that's not 250,000, right? It's key to know that some drivers have more than one violation in the clearinghouse. And so rough numbers, that means about 25,000 or more, close to that number, have more than one violation in the clearinghouse. Of all the drivers that have ever been put in the clearinghouse ever since January 6, 2020, 70% of them are still in a prohibited status. Now let that sink in. 70% of them have not gone through this SAP process, have not gone to a return to duty. They're still prohibited. So if you are an employer that's doing queries, that's checking people, you know that there are 158,000 drivers out there that are danger, right? that should be an encouragement to do these queries to make sure that you check drivers that are out there. Of all those drivers, 10% have completed the SAP program, but they're still prohibited. And that means that, you know, somebody's paid money, they've gone through the SAP process, but they haven't either tried to or haven't been successful finding an employer that will bring them back with an open violation. And that's hard. That's something that we hear a lot of it. Only 7% of total drivers have gone through the complete process and finished it up. 7% out of all of these in January 2020. All right, so how can a driver get back to work, right? So once a violation is posted, the driver must successfully complete this return to duty test program that we're talking about today before resuming safety sensitive duties for the FMCSA. Technically for any DOT agency, right? But we're pretty much talking about Clearinghouse today, which is currently limited to trucking, to FMCSA. Once they do that, a carrier must agree to hire them and perform a return to duty test. Now, one of the questions that we had that we were frequently asked questions is, you know, a return to duty, do they also have to do a pre-employment test? And the answer is no. This is the only situation where one test stands in place of another. If you perform a return to duty test, that covers the same work as a pre-employment test. The key difference is that the return to duty test, and I don't know if this is in my next point or not, no, a return to duty test must be observed, must be directly observed. And I think everybody out here probably knows what that means, but directly observed test means that someone of the same gender will physically watch the urine come out of that person's body. There's a little bit more to it than that, but it's very specific, right? All return to duty tests must be observed. And then lastly, in order for the driver to finish that plan, the carrier must, or the employer, must complete all the follow-up testing according to the SAP plan. Now, the driver is never supposed to see the SAP plan. It's not supposed to know how many tests they have to deal with. It's the carrier's responsibility to administer those tests according to the plan. What are the 6 steps, right? We're talking about the RTD process. So here they are. Once someone has had a violation, here's how you get back to work. Number 1, the SAP request is sent. So the employer gets a list of SAPs, as we talked about. The driver goes onto the clearinghouse under their account, and they select an SAP from the list the company gave them, or any SAP out there. They're not limited to the list that the employer gave them. There are lots of resources out there to find an SAP. Once they find an SAP and they reach out to the SAP through the clearinghouse, call the SAP, whichever way they go, the SAP agrees to provide services for them. At this point, the SAP goes into the clearinghouse, accepts the request from the driver. That locks them together. Once an SAP has been designated, a driver can't change their mind. You have to follow through with the SAP that you designated. You can't change SAPs midstream. You are locked into that SAP as the driver. So the driver then performs an interview, a face-to-face, whatever, different SAPs are different, but they perform an initial assessment to determine the scope of the issue that's going on. They then give the driver a list of education or classes or therapy, different ones. What we see a lot of times are online videos that the drivers have to watch. The SAP is not supposed to have any financial interest in those videos, and so it's a lot of variation out there, how the videos are produced, or in-person training. Again, a lot of different ways, and theoretically it's a case by case, right? The SAP should do an analysis on the significance of the problem and provide appropriate therapy. Once that has been completed, the SAP then logs back into the clearinghouse and says that the initial assessment is completed. Then, after the driver goes through that testing and completes everything, they meet back with the SAP, and the SAP says, okay, you're done with my part of the program. You are eligible for the return to duty test. And if you remember back to that clearinghouse report we looked at, that's where a good number of these drivers are stopped. They've completed the SAP program, but they haven't found a carrier to hire them back. Once they find the carrier has them perform a return to duty test that has to be observed. At this point, you'll see the color, the circular color changes. Once you perform the return to duty test as a driver, you are no longer prohibited in the clearinghouse. You are allowed to operate at CMV. You've gone through SAP training, you've gone through assessment, and you have performed a return to duty test. Now it's on the carrier to administer those additional follow-up tests as prescribed by the SAP until it's done. I left a step out, I'm sorry. Once you perform that return to duty test, it's the employer's job to go to the clearinghouse, and the TPA can do this for them, but it's the employer's job to go to the clearinghouse and just advise that that employee, the driver, has completed a return to duty test. The actual test results don't get uploaded. It's very easy. It takes just a second. If you've performed a query, it's the same thing with a RTD test. You enter in the information, the CDL number, the state, the driver's name, and their CDL number and their date of birth. It verifies. You upload a return to duty test notification. Boom, they are cleared to drive.
And that's the carrier's responsibility,
Yes, sir.
not the SAP's responsibility.
You are correct. You are correct. So if you look at step 1, that's the driver's responsibility. Steps 2 and 3 and 4 are the 2 is where the SAP gets online and agrees to do that. So 2 and 3 kind of go together, but 2, 3, and 4 are the SAP's responsibility. Step 5 is the carrier's responsibility, and then once all the testing is complete, number 6 is also the carrier's responsibility to log into the clearinghouse and just advise that all of that testing is complete. And again, number 6, it takes less than a minute to do this. You're not uploading copies of tests. You're not uploading anything specific. You're just advising the plan is complete. This is, the other thing to note on this slide that I think is important is that the information of a violation is retained for a minimum of 5 years. So if a person never gets past step 4 or never even starts the process, they stay on the clearinghouse as a prohibited driver forever. But once they complete step 6, the word is it encapsulates that violation, and it stays on the clearinghouse for a total of 5 years from either the date of when the SAP is done, or if that's taken longer than 5 years, then it would go off as soon as the follow-up completion test is done. So a minimum of 5 years, but it can be longer.
And the prohibited status is automatically triggered at step 5.
The non-prohibited
At
status.
the completion of step.
Yeah.
The non-prohibited is
non-prohibited. Right.
Stop,
Now,
step
I don't remember
not
if I put
step
this
6.
slide. Not step 6. Correct. You are able to drive at step 5, but I'll tell this is something I don't think I got this slide in here. Maybe I did. It's worth saying twice, even if I didn't. When you perform a query, a pre-employment query on a driver, and it pops up not prohibited, you gotta click that details button at the bottom left of the query. You have to. That's where you see if a driver's in an SAP program or not. If you don't click that button and you just take it to be non-prohibited and you let them drive, and a year goes by and you realize that you've been letting them drive without a follow-up program, or God forbid there's an accident, that you're liable for that. So you've got to click that details button. I hope I put that slide in there. If not, we can shoot that out later on. But anybody that's performed a pre-employment query knows what I'm talking about. You'll see that down at the bottom left. It says details. They say the devil's in the details, right? Click the details, see if there's a devil in there. Driver's responsibility. Their job is to request an SAP from the list provided. And this is rehashing what we just talked about, right? So we'll go through this fairly quickly. They then have to participate in the SAP program. They then complete the applicable education of treatment prescribed by the SAP. This is a hard one. They have to find the employer, willing to get them back into service and perform that return to duty test. This one is harder than you think. They have to pass that return to duty test after they've gone through the SAP, paid the money, found an employer. Some of them don't make it past this step to pass the return to duty test. Once they do that, they have to pass all the required follow-up tests. All of these follow-up tests also have to be directly observed. You think about a drug test as kind of like a trust concept. Most tests that we do, you give a driver right to privacy, at least the first part of the test, if they give it back to you within a good specimen. But for return to duty and follow-up tests, they don't have that right to privacy. The employer is tasked to test them, and to you want to have them prove that they have truly gotten back away from illicit drugs and or alcohol.
Hey, Grady, kind of at the topic you're on, we have a question about, so we don't have to attach any of the follow-up drug tests? Do they have to attach information about follow-up tests?
No, sir. If anybody follows any of the new regulations, the regulation was written by Gian Marshall, and Gian and I are fairly close. She's no longer with the clearinghouse. We had an in-depth discussion about this, and her statement was this: the clearinghouse is a government entity, and therefore it is subject to right of information. And so if you upload all that sensitive documentation, somebody has access to it. So we don't put that information on the website of the clearinghouse.
Okay, thanks.
So the SAP responsibilities, they have to agree to provide that service. They don't have to. Their job is to agree. There are actually, if you look at that clearinghouse report, there are a significant number of SAPs that have declined to work with someone for whatever reason. That's their jurisdiction there. Once they do agree to provide that service, though, they have to recommend the applicable education or treatment. Then they evaluate the driver after that treatment is done, and they make a follow-up testing plan, which again does not go to the driver. It goes to the employer. The driver is never supposed to see their follow-up testing plan. They're not supposed to know how many tests that they're going to be required to take. It's supposed to be all surprised. They then give that plan to the return to duty employer, and that's pretty much the end of the process. They're supposed to follow up with the driver. I don't know how much of that actually gets done after that's moved on. The employer responsibilities, and I feel like that's pretty much everybody on the discussion today. Like we said, they have to notify the clearinghouse of a negative return to duty test, not the actual upload of the result. You log on, you just advise that on this date they had a negative return to duty test, and it's that easy. They do have to comply with the SAP plan. Anyone out here who is hiring SAP drivers or contemplating hiring SAP drivers, highlight this one. You have to have that plan, and you have to follow it. If you don't follow that plan, you are liable. If there's an accident, if there's an audit, you are hiring, by definition, you are hiring a liability, and that's okay as long as you manage it, right? You have to follow this SAP plan. Your employer's responsibility is also to notify the clearinghouse when that SAP plan is completed. And again, like I said, that's as easy as uploading the negative return to duty test result. You just notify the date that it was done, and it's that easy. If you hire a driver that's part of an SAP plan, they had a return to duty employer already, or 2 or 3 or 4, you do acquire those previous results from the previous employer, or if you don't get those, start the plan all over again. You can't take the driver's statement that says, you know what, I've already done a dozen tests, and just write it down and go on with it. You have to have that documentation. Even though you don't physically have to upload that to the clearinghouse, you have a follow-up plan that may come into question. You got to make sure that you have copies of all the results that are required.
Now, the follow-up testing, that can be unique and different?
Yeah. I think I go into a little bit of that. The minimum for a follow-up testing plan is 6 tests over a year. That's the minimum. They can go up to 5 years. An SAP can ask somebody an employer to do follow-up testing for 5 years, anywhere from 1 to 5 years, and an unlimited number of tests. And you see a lot of variation there. You'll see a lot of those minimum tests. We've seen several that go the full 5 years that want a monthly test every 5 years. And theoretically, it's due to the severity of the problem that the driver may have when they're evaluated. So, just a handful of notes of different things that have come up as part of this discussion. One thing you want to do is if you're contemplating, check with your insurance. We understand that some insurances are, it may be a significant premium to hire somebody with the liability. Some insurances don't care at all. So how you're set up, it's just a good idea to double check with that. This is another key point. If you have a driver that has a violation, positive drug test, refusal, or whatever, they go away and they go through that SAP plan. You do not have to perform that return to duty test. And we've had employers that are pressured to do this by SAPs and by drivers. Unless you are bringing them back to work, it's not your place to do a return to duty test. Don't do it unless you're actually going to work that person, right? The reason they want that, remember that step 5, as soon as they turn green, they can go apply to other companies and they might find somebody that shows they're not prohibited. They want you to give them that test so that they have that green light to go out in the world and start advertising their services.
Even if you're not going to hire them.
Sorry, only if you're going to hire them. Exactly. Only do the test if you're going to hire them. And likewise, only an employer can order an RTD test. Now, when I say you can order, what I mean is you're authorized to order. We see medical clinics, I think we had one this week, where a driver walked into a medical clinic and they did a return to duty test, and it wasn't even on an employer to do that. They ran into issues because they couldn't upload it to the clearinghouse because they're not an employer. But they can check a box, they can get that done. But by regulation, only the employer can order that. It has to be directly observed and does take the place of the pre-employment test, as we've talked about. A couple more notes, and we've said this several times. Now, and the reason I harp on this is audit bait. You get audited, you get an SAP driver, and that auditor comes in, they start looking at those chain of custodies, and they're not observed, you're paying for that. That's a big no-no. Make sure that it's super easy. It's a checkbox on the chain of custody. It says that all tests have to be directly observed. Just make sure that all those are And again, SAP plans and follow-up tests are not stored in the clearinghouse because it's public record. While the return, and this was, somebody asked us this question, return to duty tests, they take the place of the pre-employment, but follow-up testing is completely separate from the random program. Every DOT employer carrier that is subject to drug and alcohol rules has to have the random program testing for FMC. Say it's 50% at the drug and 10% alcohol this year. If somebody is subject to an SAP plan, a return to duty plan, those tests that you have to do are completely separate. So if they get selected for a random and you want to give them a follow-up, that's two different tests. You could technically do those in the same day, but that's pointless. Use those follow-up. You're trying to ascertain that this person truly is, on the straight and narrow. So don't do them on the same day. Spread those things out.
But they are part of the pool.
Yes, sir. They are. Once you have hired
pool.
them with a return to duty test, they are part of the pool. Exactly right. And they are subject to random testing. Right. All right. So how long? Somebody asked, how long does an SAP program cost, and how long does it take? So it can be done in as little as a few days. If you get with the SAP, go through the evaluation, watch your videos, go to the class or two. We've seen a week or less. We can see people that are ready for an RTD test. SAPs, the costs vary widely. From what we've seen, it's about $500. Remember, we are an MRO TPA, so we don't really concentrate on the SAP part. That's not, we could do that, but it's not, we never felt it's right to tell people they're positive for a test and then take their money to get back through the program. So we don't get into that area too much. We don't price that out, but it's about $500. If anybody in the chat knows differently, feel free to correct me on that.
Be great. Can the charges for the follow-up test required be given to the driver?
Yes, sir. Absolutely. And there's a couple of ways to do that. What does not work well is tell the driver to go to a clinic and get a follow-up test done and pay for it. The reason for that is because when the driver goes in, the result goes to the clinic. It's hard to get to the driver. It's hard to get from the driver. So what works better is to actually have the test done on your account through your MRO and TPA so that those results come to you. And if you've got a good MRO TPA, you should be able to get the MIS reporting, all that's together, and then just take the cost out of the driver's paycheck. Or, one thing that we've talked to a couple of companies about is negotiate a lower, a mileage rate or hourly rate or however you're paying the person to account for that. To make sure that they know this is something that they're subject to. But yeah, the regulations do not address payment for this testing, so you certainly can if you want to.
Okay.
Again, the education or treatment can take a few days, and this is the SAP mandated treatment for the driver. So we've seen it take a few weeks as well, and a lot of times I think that's just the driver that doesn't get around to doing the education. Most of the time, it's not a tremendous amount of education that they're prescribed to. The hardest part seems to be finding an employer willing to hire a return to duty driver. And I don't know how many people out here are, actually doing this already, contemplating doing it. I can tell you that, a lot of the companies that do the return to duty program, they find that they'll hire a driver. The driver won't stick around through the entirety of the program. They go through that effort, like you said, Steve, they'll go through a couple of tests, get a green light, then they'll disappear. A lot of them also, you have somebody who's positive for a drug test. It's not 100% correction going through this SAP program. So there are a lot that will fail either the return to duty test or one of the follow-up tests or random tests. You find a much higher positivity rate amongst RTD drivers than you do through the overall employee pool. And as we've already said, the minimum follow-up plan requires 6 tests over a year, but the SAP can direct that testing for up to 5 years. All right, a lot of people say, all right, well, what if I just don't do that? What if we just keep going? Keep our head down, get the job done, get the load across. The book says $2,500 per violation. When we look at the actual negotiated rates, they're a little bit less than that. We see, $1,800 or so per violation that have been assessed by DOT. I think a lot of that is that the DOT is not trying to just destroy companies over this. I think they want companies to be compliant. So I think they're being a little lenient still. We saw a couple of years where this wasn't levied at all. But the most important part is this. If you have somebody that's prohibited in the clearinghouse and you hire them without doing a query to check to see if they're prohibited or in a follow-up plan, or if you don't perform that follow-up plan and something happens, it's done. I didn't bother to check with any lawyers. I would say it's 100% loss of the lawsuit if the driver has a violation and you could have known about it. Somebody gets hurt, something gets hurt, whatever, but somebody gets hurt, that's a bad deal. This is why you want to do this, is just because we all want the roads to be safe. I think everybody here on the call, you're working with Infinity, you work with a good MRO TPA, your goal is safety. Your goal is not just compliance. We want to have a good road. So what other programs fall? This one is, we're nearing the end, other than whatever questions we have here. So, but we see a lot of people that, what about Clearinghouse? What are the programs? When you log into the Clearinghouse, you're using login.gov, and this is a centralized credentialing database that the government has used. A lot of you have realized lately, just recently, the FMCSA portal, which used to be one of the worst designed products in the entire world, the website was horrible, has now gone to using login.gov. When it works great. If you missed the boat on that, if you messed something up, it's still really hard to get the portal fixed. But now login.gov works with both your Clearinghouse and your FMCSA portal, and even other sites that are government based. The other one is the portal. So here's a screenshot of what the FMCSA portal looks like. As you can tell, this is not exactly the newest website on the market, but they did fix the back end where it was logging in was just terribly bad. Now where it uses login.gov. The portal is the website that links enforcement, FMCSA, and carriers together. You can see your inspections, you can do your MCS 150 forms, you can see a little bit of Clearinghouse. And in order to link these two things together, there are a few roles in the portal that you have to have access to, and you can do yourself. We can help you. There's stuff available online. It's pretty easy to do. Then you have CIDLIS, right? The CIDLIS is the CDL information system, and it's simply a national database to ensure that each person only has one CDL, so that if you move from state, and we see these questions a lot, what if this person changes states? What if they get a new license? What if, whatever happens? If it's working well, and by large it does, the CIDLIS does a good job of making sure that it follows that person, right? That one license gets closed down when another one gets open. There are exceptions, there's certainly problems, we deal with them regularly, but that's the idea behind it. So those are the three main software that a lot of people don't know. When you do a query check, when you are, or even a return to duty check in here, when you verify that driver, when you put in their name, their CDL number, their date of birth, it's going to CIDLIS. And it's saying, hey, do I have somebody with this date of birth and this driver's license that's in the system? And when they verify, it's verifying in CIDLIS. Then when it goes to the query or to the violation screen, that's when it's actually in the Clearinghouse. So you actually go through all three of these when you are, well, not as much the portal, but you go through login.gov, CIDLIS, and the Clearinghouse when you are doing any work in the Clearinghouse with queries or violations. All right, lastly, what is Clearinghouse 2? That's coming, right? We've had Clearinghouse, now they're calling it Clearinghouse 2. It's scheduled for later this year. May be put off, may not. It requires state driver's license agencies, DMVs, whatever you want to call it, to downgrade a CDL by removing the CDL privilege when the driver is marked as prohibited in the Clearinghouse. This is good. Anytime you have technology and synchronizing, you know that sometimes it's going to go bad. So if you have a driver that's accidentally prohibited, unwinding that might be pretty complicated going forward. It'll take a little while to figure out. But it is good because when it works, if somebody's prohibited, it should almost be instant, within 24 hours, where the person no longer has the legal ability to operate a CMV. But it may make the reinstitution of a CDL more complicated, as I said. All right. Lastly, just kind of leave me with this. Workforce QA, we are the most involved MRO TPA in the industry. Nobody else goes to more industry seminar shows. We try to do more talking. We have some incredible experts on board. Our key expert is Dr. Donna Smith. She actually wrote Part 40 when she was with ODAPSI before then. So if you need anything after this, you have my information. You've got Steve and Mark, both excellent resources. Happy to reach you, happy to help you in any way that we can. All right, guys, that's the end of the little talk. Do we have any good questions from the audience?
Yeah.
We have lit up the questions, yes.
All right.
Mark, you want me to go ahead? I'm going to take some out of the
ahead.
chat here first, and we also have some over here in the Q&A. We have a question here. When the driver completes all the follow-up, do we have to send the driver to do a RTD, and that RTD must be reported? So what would be the process after they've completed all the follow-up?
So the RTD comes first. They go through the SAP, then they do the return to duty test. Then you send them for the follow-ups, and follow-up testing is at the convenience of the employer. It's not really randomized. You get to send them whatever you want, but when they have completed the number of follow-up tests, You log into the clearinghouse and you say John is done with his follow-up testing, and that's the end of it. And John does not have to take any more follow-up tests. He's still in the random pool, still subject to reasonable suspicion if that's ever a problem, and post-accident, but he doesn't have to do any more return to duty work.
Great. Matt has asked a question. What happens if there is a positive test result during the driver's follow-up plan?
That never happens, guys.
Yeah.
Yeah, it's treated just like any other positive. You report it. You handle exactly the same way. Don't get distracted by the noise. If they have a positive test for any reason while they're in the follow-up plan, you report it to the clearinghouse. Someone reports it to the clearinghouse. If it's a positive drug, the MRO reports that to the clearinghouse,
Right.
like we showed. Once it's in the clearinghouse, you remove them from safety-sensitive duties. You give them a list of SAPs and remove them from duty. And if you want to hire them back when they're done, you can.
Very good. Great answer. Another question, what happens if they don't pass, this is basically the same question, where they don't pass any of the follow-up tests or return to duty? So
If they fail one, stop.
Yeah.
No do-over. Right? If they fail a test, they're out. Now they can come back after another round of SAP, and we see that. We see somebody that's gone through 2 or 3 rounds of SAP. Once
Yeah.
it gets to that point, I would think very seriously about hiring them, but
Yeah.
to each their own.
They have an unmanageable problem there, so.
Right, and there's people. It's unfortunate. It is unfortunate. Drug use
is.
is a problem. It really
Yep.
is.
Here's a question. What if a driver had a positive test, but previous employer didn't report to clearinghouse? Is there a return to duty that needs to be completed? I'm trying to understand the questions here, so.
Yeah, that's a nuanced question. There's a lot of different answers to that. If you somehow find that someone had a positive test and that some MRO didn't report it into the clearinghouse, how you handle that. If somebody has that specific question, wants to ask me offline, we can. I don't think we can get into that too much. One answer, if you somehow find out, that becomes actual knowledge. So if you know that there was a positive test that's not in the clearinghouse, remember we showed you the actual regulation. So if you have information from a previous employer, you
Right.
could post that violation in the clearinghouse, and then that driver would be that way. That would be the best way under most situations.
Okay, very good. Here's a question from Leo. This one was already answered about passing on the charges to the driver. So here's the next one. How would you address a situation where there's nothing in the clearinghouse, but someone reports a positive on paper when you send the previous employer safety verification?
I think that's the same thing. If they have a positive test now, I would definitely reach out to the clearinghouse and find a way to make sure that whoever failed to put that in the clearinghouse was re-educated. That's not your job necessarily, but go to the clearinghouse, make sure. I would make some noise about that, but one way to handle that would be to treat it as actual knowledge if you have that information and you're sure, right? You don't just want to take it on a piece of paper. You want to call, ask them what the heck they're thinking, letting this driver drive with the violation on their record, that kind of thing.
Right. I'm going to switch over to
on the actual knowledge. Gabe had a great question. Can video cameras be used instead of a observation?
Ooh, that is a good question, Gabe. All right, let's talk about 2 different things. So reasonable suspicion testing is not what we're talking about today, but we've had a lot of discussion with cameras on reasonable suspicion if somebody's acting impaired. So you got to draw a clear distinction. If you see someone smoking a marijuana cigarette, and you know that it's one thing, you can't smell it online, right? So was it a real cigarette? You got to be absolutely sure that you have someone drinking alcohol or whatever. Then I see no reason not to, and you could upload that as documentation to the clearinghouse. Here's one thing: the clearinghouse. One reason I love it is because there's no penalty if you report someone to the clearinghouse and then a safety auditor decides that was not a violation. So before now, if you were before the clearinghouse, if you as an employer were questionable about something, you had to make a call. Well, now, go conservative. I mean, you don't want to ruin somebody's life, of course, but report in the clearinghouse if you think it should be, and if the driver questions it and then wants to, they have the right to question the clearinghouse and to have the safety auditor, a safety inspector to check that out. They can tell you that you were wrong, and then you know.
Very good. Here's a question from Jonathan. Says, if a driver in an SAP is pulled for a regular random test, not part of the return to duty follow-up, does that regular random test need to be directly observed?
No.
You may have answered that.
No, I didn't. That's a good question. No, it does not. Only return to duty tests and follow-up tests have to be observed. I'll say this, all testing random pre-employment, if the driver goes in and they produce a sample that's questionable to the collector, if it's out of temperature, if it's purple, it smells like bleach, it is the collector's responsibility to immediately proceed to a direct observe. So in that situation, of course it would, but right off the bat, a random test does not need to be observed. And for what it's worth, any reasonable suspicion test, that is not observed either unless they give some. When you send someone for reasonable suspicion, it's not observed right off the bat. Only return to duty and follow-up tests are always observed.
Very good. Here's another question from Honey. It says, if we are using a third party to pull Clearinghouse, should we also go into Clearinghouse to verify they do not have any open SAP?
I would hope your third party did that for you. But somebody should. You have to click the details. Always click the details. I've talked to too many companies that have hired somebody. They've called me and they always say it in a very hushed tone, even though they're on the phone, and say, "What do I do? I've been working this person for a year, and we just found out they have a violation. We haven't done the first program. We've done the first test. We can't even get a hold of their SAP. We don't know where they are. We don't know what to do. We can't fire them. We've been working them for a year, and that's messy. Don't get in that spot."
Very good. Let's see here. From James.
James has got a great question.
Go ahead, Mark.
Oh, well, sorry, we're out of time. Got to go.
Admission of drug use by CDL employer need to be reported to the clearinghouse.
A good nuanced question, James. All right, so I think we had this in I could pull back up the actual knowledge slide, but anybody who wants to go to part 382 and look at the definition for actual knowledge, here it is. If someone admits to you that they have a drug problem before they are selected for a test, okay, they just walk in, they have not been selected for a random test or anything, under certain circumstances, if you have a program and it meets the other guidelines, that person does not go in the clearing. That person goes into treatment, right? Type of a rehab. I forget what the exact, but it's admission situation. However, if that person has been picked for a random test or a reasonable suspicion test, and they decide that that's the moment they need to tell you that they use drugs, too little, too bad. You send them for the test. If they refuse, it's a refusal. But if you don't have one of those programs, and if somebody, if you cornered them and then they admit, those all fall under actual knowledge.
Very good. Another question here from Gabe. Once the follow-up testing plan is completed, does all evidence of the original violation appear anywhere on, I guess that's DAC, D-A-C-H?
DACH is an acronym. Not a lot of people use it, Gabe, but you're on this. Drug Alcohol Clearinghouse, DACH. Okay. So that's something we use sometimes. On the portal, you'll see that as well. The employer should maintain that documentation, I would say, for 5 years minimum. Myself, to keep that. I might keep it for the, in a file for the longevity of the driver, just to keep that. But again, none of that goes on the Clearinghouse website because it's public record, and so you don't upload the SAP plan or any return duty test results or any of that stuff on the actual Clearinghouse website.
Very good. Stan here is asking, would love to have the 6 steps of the return to duty process saved on my computer. Will it be available?
I'm sure we can share these slides if that's not already part of the plan. I know this is being recorded, and yeah. I'll tell everybody a secret. That slide came directly from the Clearinghouse. So there's a good Q&A section on the Clearinghouse, so you can pull it up and see where that is. That's
fantastic. Yeah, just so everybody knows, everybody will get an email back from us once this thing has been processed and recorded, and be provided with the link so you can view it again, share it with people that couldn't be on today. I can forward a copy of the slides to anybody that wants them. We could actually include a link to that in the email we send back so they could have all the great information, if that's okay with you, Grady.
Absolutely. Yeah. Love to have it. Hope everybody finds it useful.
Very good. Here's another one for Christina. Why the local driver for a box truck can't be registered to Clearinghouse if they are positive? Says with a regular driver's license. I'm not sure I understand the question, Christina.
So federal drug and alcohol regulations apply for a driver that's operating a vehicle that either weighs or is rated to weigh 26,000 pounds or more. Mm-hmm. That's the main thing. And the other ones are if it's designed for a vehicle that's designed for 16 or more passengers, or if they're carrying any hazmat. Those are the three things that are subject to drug and alcohol. Typically, box trucks are not subject to drug and alcohol violations, so you can still test them under non-DOT, but they're not supposed to be tested for DOT, drug and alcohol. Box trucks typically do fall under DOT medical card guidelines, and so under Part 3, is it 390, 391, they are considered a commercial motor vehicle because they do have to have a DOT physical, but not drug and alcohol unless they hit that 26,000 pounds, 16 passengers, or hazmat.
Right. Another question. Do you feel that the return to duty process is causing so many drivers not to return to trucking after a drug test or alcohol violation? Do you think the clearinghouse will come up with a different process for return to duty?
The clearinghouse did not change any of that. The only thing the clearinghouse changed was that you had to notify the clearinghouse, and if you took all of the actions required together, it may be 5 minutes worth of work for the clearinghouse itself. What we see is the clearinghouse has shown a spotlight onto a broken process. We had drivers before that were sneaking through the process, and they were trying to get hired. And a lot of those just weren't coming back. We have a large, and let's be clear, everybody, if you look at the data on drug and alcohol testing for the entire country, the entire general workforce, it's a lot higher than DOT. DOT drug use is very well regulated. It's been very successful. We have around a 1 to 2% positivity rate every year. Now, two ways to look at that. 1 to 2% is tremendously lower than general workforce, but that's a heck of a lot of trucks that are out on the road that are still positive for drug and alcohol violations, and you don't want to be next to any of them or anybody that you love. So it's been very successful. I don't think they're going to change that program. No, I don't. A lot of people, maybe the next question on, this is a hot one. What are we going to do about marijuana? We don't want to get into that today. Maybe that's another webinar.
It probably is.
Yeah.
Here's a really good question. What's the process if you are working on follow-up testing and terminate the driver for non-drug related reasons before they're done with the follow-up testing? Is the employer still required to continue with follow-up testing?
Nope.
No.
Only if you're having to continue safety sensitive operations. So if they quit or if you terminate employment, no, you do not continue follow-up testing. It's actually would be, I'd have to struggle to find the violation, but you don't do that. What you do want to do is if the driver goes down the road and applies for somebody else, they're probably going to ask you for those records. So if you're working SAP drivers, you want to have a good process where you have a release for those records that the driver would give you, because you can't just send those records out to anybody. And keep those in a place where you could easily give them to the next employer rather than having to pull them all out.
And here's another really good question. What happens if you find out later that you've been employing a driver for over a year that has not done a follow-up test? If we start the testing now and moving forward, are we in compliance?
Yeah, that's a good question. And it happens, right? Click that details button. See if somebody's in the program. Make sure that you're managing it. It's one of those things. If you manage it, you can work SAP drivers. If you're not, don't dip your toe in that pool, right? Not even for somebody that you think is a good person for whatever reason. If you don't have a good way to manage that, don't do that. A lot of DOT, if you're ever on the stand or being audited, is when did you know and what did you do about it? And I think if you follow that, as soon as you find out that somebody's employed, you don't have grounds to terminate them, start that follow-up program right away, get that done. If you can't get the follow-up program from the SAP, then take them out of safety-sensitive duties until they can get you that follow-up plan, because you can't proceed with the follow-up testing until you have that plan.
Here's a question from James. Can a reasonable suspicion interview be done over video chat in the event you get a report from a shipper that driver is suspect?
Oh, that's a good question. That's not what we're here today to talk about with the return.
Right.
But that's okay. So I've asked that same question myself. I'm going to struggle to get the exact wording from the return, the reasonable suspicion, but reasonable suspicion testing has to be, I'm going to pull this, but it's timely, right? You have to have, you can't say somebody used the drug yesterday, and contemporaneous is the word. Contemporaneous, which means now. You have to have that information. It has to be, so if a shipper tells you this person is high or whatever, if you get on and you have a phone call, I don't think that that's going to give you enough information. You can't tell enough over the phone. But if you have a video call, if you can see the behaviors, you can't, there's no smell-o-vision, so you can't smell drug or alcohol use on the person over a video call. But if they are clearly slurring, if they're clearly acting disheveled in such a way where you feel that you can justify a reasonable suspicion test, you could. But here's the rub. You can't tell them to drive down the road to a clinic to get a test once you think that they're high on drugs.
Yeah.
So you have to have a way for somebody to escort them, take an Uber somewhere or another, tell them to stop driving your truck. So while I quote Chris Rock all the time, the comedian. He says you can do it, but that doesn't make it a good idea.
Yeah. Here's an interesting question from Sarah. Said, we accidentally ran a non-regulated pre-employment on a driver. He tested positive. We were undergoing an audit at the time. The auditor found the mistake. She said to retest him about a week later. He passed, and she said he could drive, but I had already posted the unregulated test to the clearinghouse. So auditor said he could drive, but clearinghouse shows him out of compliance. That was a mouthful, huh?
Yeah, technically I think that's correct, but I don't like it. You don't have to. I guess in their situation, what they're saying is they had hired this person based on a non-regulated test, but she said no because she said it was positive, right? So
that was positive.
There's some holes in that, or I'm confused. If you do a test on someone that's positive, even if it's a non-regulated test, I would not expect you to proceed with that. I guess the question could be if the person came back and wanted to retest, you could let them retest. I don't think I would do that. I think I would tell them that they didn't meet my company guidelines since you were aware of a drug and alcohol problem.
Well, it sounds like they did the test wrong. They accidentally ran a non-regulated pre-employment on a driver.
Right.
So I
but
guess
if it was positive, you probably wouldn't have hired the driver.
Yeah.
She said pre-employment, right? Was that part of the question?
Regulated pre-employment on a driver.
So I wouldn't have expected that driver to be hired. If you're being audited, you could let the driver, if somebody fails a regular, non-DOT drug test, you technically could let them come back and test the next day on DOT, and they could technically pass and drive all day long.
Yeah.
But I'll quote my buddy Chris Rock again. You can do it, but don't do it.
Yeah. I got it. Okay, that question was answered. That question was answered. Let's see if there's any others. Gosh, I don't see any other new ones. Anybody else have a question or one we haven't got to? Oh, somebody asking, is there a webinar on reasonable suspicion to watch? Well, maybe that's one we'll have to put together. We haven't done one, at least not recently, Amy. So we'll have to look into that. Maybe that's another hour that's well worth talking about. So I think all I wanted to say, I think we've come to the end of the questions. Just so everybody that's on knows, you'll get a message back from us, an email letting you know that you can watch the replay here. I'm going to see if we can include the slides with that email so everybody gets a copy of them and has all the nice information and information about Grady, of course. And I also wanted to, to mention that, there's training also involved here. And you all know that that's kind of what we do here, is to make sure we're providing quality training. And I just want to pop this little poll up on the screen here that if you agree that drug and alcohol training is important, and part of this is keeping people from getting into that circumstance to begin with. So if we're training our drivers about it, and you'd like to know more about what we might be able to do to help you get that training done, then answer yes here on my little poll that I put up on the screen. So Grady, this has been one of the most informative webinars I think we've had in quite a while, and it looks like the audience agrees. A lot of thank yous, a lot of very informative, really, really good program. Thank you very much, sir.
Thanks,
I'd like to ask everybody on chat just to give a thank you to Grady for helping our industry cope with this impairment problem that's out there. We really do appreciate the work you've done and the collaboration with the FMCSA. Somebody did ask about who pays for it. I think the answer is the driver normally pays, but a carrier can pay for it. Is that correct?
Yep, yep, both the SAP, yeah, exactly right, Mark.
Yeah.
So on chat, let's give Grady a big thank you.
Well,
Thanks,
we're getting
Mark.
hundreds of them here, so it looks like, so that's fantastic. Grady, thank you much, sir. Thanks to everybody that joined us today. I think everybody got a lot of really good information, and we'll make sure, like Grady said, if you have any other questions, you can send them to him, you can send them to me. We'll get the answers for you. So once again, thanks for everybody joining us today, and we hope you come back and join us on our next webinar. Grady, thank you, sir. Appreciate it.
Thank you all.
Thanks to everybody.